Hi, my name is Dr. Karen May, and welcome to Everything Neuropathy. Today, we are going to talk about neuropathy, what polyneuropathy, mononeuropathy, and what does that mean? Know that I am the owner and physician at Momentum Health Neuropathy Center in Mason, Michigan, but I'm also a neuropathy survivor. So this is my passion, is to empower people like you through natural and effective solutions for your neuropathy. So sometimes it starts with just basic definitions and making certain that you understand at a high level what's going on. Please know that this is just good information. This is at a high level. I have other videos that go a little deeper. So neuropathy means that there's a disease process or damage happening to the nerve. And so we have polyneuropathy and we have mononeuropathy. Please know that neuropathy truly happens outside of what's called the central nervous system. So your brain and your spinal cord, that's the central nervous system. The peripheral nervous system is anything outside of that. What goes down your arms, into your fingers and your toes, down your legs, around your organs. And so the body has over 45 miles of nerves coursing through. So if you were to drive 45 miles and then think about how that is all wound up and spread throughout your body, is just remarkable. And there's different types of nerve fibers in the periphery as well. There's large ones, which look like copper wires, with like thick copper wires with a thick fatty coating. Those ones are balance and vibration and joint position sense. Think when you close your eyes and you feel like you're going to fall over, it means your brain and your feet aren't connected and your brain doesn't have you mapped as to where you're standing. There's small nerve fibers. And for sensation, those are light touch and temperature and pressure. Think the burning that you experience at night and the aching that you can feel, the tingling. So those are thinner in diameter. Small is really what it means, and they may or may not have that fatty coating on top of them. They also sit closer to the skin surface, so think itching can also be part of that. And then there's also pain fibers, and that's a subset or part of those small nerve fibers, but they have very different functions. And then that's the sensory part of it. And you also have within that, you have motor. So those make the muscles work. And then there's also autonomic, and they help make your organs work. And throughout your entire like body cavity, there's small nerve fibers that sit around all of those organs to help those organs do their job as well. So when you have a mononeuropathy, it means there's one nerve fiber bundle being impacted. And the most common one is carpal tunnel. So those are the ones that there's usually compression, there's trauma, there's something going on directly to those nerves that they can take some of that pressure or reduce some of that trauma, and that nerve can get healthier again. That's the point of when people do carpal tunnel surgery, or they do physical therapy, or they get adjusted, or acupuncture, whatever you do in order to help that. It means there's mechanically something going on, need to take that pressure off, and it makes a huge difference on how that nerve can function. Now, how long it goes on also depends on how long the damage is. So then there's polyneuropathy. That means lots of nerve fibers are being impacted at many different levels. There's over 100 different reasons for like the root cause of neuropathy, but poly just means large nerve fibers, small nerve fibers, those autonomic, multiple nerve fibers can be affected. Poly means many. And so that is commonly what we see with a chronic neuropathy. That's the pain that starts slowly and then it increases in intensity. That's the balance that starts to go away and then all of a sudden balance is getting worse. That's that numbness that many people experience as well. So know that neuropathy has many causes, but we need to know, is it poly or is it mono? And so all of those have different options of what can be causing it, and also options for taking care of it. Now, if you're anything like me, when I was diagnosed with a rare surgical complication, it was 1 in 100,000 chances. I ended up without the use of my entire right arm, down into my torso, my diaphragm, face. There was lots of things going on, and it was a neuropathy. The cause was happened to be that my body didn't like something during surgery and attacked it. Yours may be that you had chemo and there was an assault, a chemical assault. Maybe you have had high levels of statin drugs. Neuropathy is a side effect to high level statin drugs over many years as well. Maybe it's diabetes, but also maybe you don't know. Your doctors don't know. And so you may have had trauma in the past. So there's lots of different reasons for neuropathy, like I said, over 100. And, but really it comes down to what can you do to make it better? So we have a very unique approach to taking care of that. I would love for you to hop onto one of our webinars to take a look, but just know you got to work on the inside to get healthier in order to see help and repair, to even think about healing nerves, which can be done. So catch one of our other videos if you want to learn how that can be done. But now you have the definitions of neuropathy, polyneuropathy, and mononeuropathy. Thanks.